experience is like a big one right now. So this is like the with the somatic experience that you want to. It's quite trauma focused, like at the treatment for the people. So if you experience some kind of like unique experience in life, which was very hard to deal with in that moment, and you have not been able to like fully process it, like maybe in car accident or something like that, it could be very likely that that you will, like, some parts of your body or many parts will like kind of store it, like kind of tied it or kind of have these emotions set. And somatic experience is focused on that now, and there have been many books about it now, many like trainings, courses, that you focus on releasing these parts again, and then you can, like, as a very normal human experience, just process it.
Yeah. And what happens if you don't release these emotions? Can it become chronic, or turn into a disease?
Absolutely, yeah. So if we, for example, stay with a car accident, it can definitely develop to something like post-traumatic stress disorder. So if you, maybe afterwards you might have difficulties like driving a car, or like being next to somebody who drives a car. But it can also lead to a little bit more unaware situations. Maybe you're getting like more easily irritated about loud noises, or maybe, watching if somebody's behind you, so just because you had this experience. And that can definitely very well be for the rest of your life if you don't get it treated. And that's what actually happening a lot, that we had, everybody probably had, how many of these great people saying of had some sort of traumas, like smaller, bigger. So, but we often don't know, right? We often don't know, like, why am I getting irritated by that? Why is Emmanuel not getting irritated? Why is it me, right? Yeah. And that's why I think just therapy overall, also coaching, you don't have to have like a big difficulties in your life, but it can be so useful for everyone just to get to know yourself better and the people around you as well.
You said that there is for sure psychological consequences of these emotions stores in different parts of the body, but are there physical consequences as well for these emotions? Like, I mean, for example, I seen that the rates of autoimmune diseases have gone up in the last 30 years. Also, I saw that cancers risen also from people who are below 50 years old in the last years. So I'm wondering, is also this is there is a connection there.
Mm-hmm. Yeah, it's great. I love that topic as well. For sure, it's like the psychosomatic combination. It's like, when we think about it, like, we might often think about pain in that sense, right? Like, some people might have like some pain somewhere, but they can't quite say where it is. For some people, it might be even floating in the body. And
Wow,
maybe,
that's interesting.
have you heard? Do you know?
No, this is the first time
Okay.
I heard. I mean, I thought when you said that there is stored in the body, some people get, I mean, I guess myself included, when I get stressed, there is a knot in your, maybe in your back, but that it moves around the body. That's super interesting and shocking as well.
But these people have difficulties, right? Because when they go to the doctors, like, I have like pain in my, I don't know, hips, but then I also have like the upper back sometimes. Sometimes I have digestion problems. Then I feel tired. Like, it's really difficult to grasp, right? Because it's like okay, it's, you don't have something specific, right? And then there can be that. I mean, of course, there's like a lot of like doctor like research, or like not research, but like how do you say it? Like doctor treatments, or they try to find where the issue is, right? But if people look, and often these people, it can be extremely frustrating, because it's like pain, tiredness, or maybe skin, it can be many things. And if they don't find somebody who can help them, it's a very common thing that they do kind of like the doctor hopping. So they go to one doctor, to the other one, just to find the issue, because it's really like maybe restraining them for life.
I actually wanted to talk about this practice. I talked about this with my last guest, one of my last guests, about there is a practice in Ecuador about using the egg to rub the body of a person because this person is feeling bad, feels under the weather, and I don't know if this has something to do with what you said to describe these stored emotions, and who knows what the egg might do. Yeah, I mean, I used to dismiss all of these things, but the more what you say about these methods sounds I stop being like, okay, this is something that is only matter. You can say, okay, I can see this and I can describe it in a scientific way. But and actually, I wanted to ask you this part: how do you people or our scientific community describe this phenomenon?
If you have like some physical experience, but it's not organic, you mean it's not it can't be found in the
That these emotions move around the body.
okay. That was as an example. So it would be called like a psychosomatic disease, if I translate it right from the German one, psychosomatic.
I heard about it actually, but I mean, this is the first time I heard that it travels around the body, and but is there is an explanation and why it travels around the body? And
I think it's more about like, again, just as an example, like because it is not organically, or as far as we know now, that there can't be something bodily wise found. So because of that, the psych is not like maybe saying, right, so if you have like a broken elbow, of course, like the pain would be around the elbow, you would think, overall, right? But if you have like maybe there's more in the psyche, something that happened, for example, like a trauma again or so, maybe that's not necessarily connected to just one body part. That's why it's like maybe just changing overall, because it needs to go somewhere, but it doesn't have a specific spot, if you know what I mean.
yeah, but I mean, as the body is, I would say the word full, but maybe there is another word to describe it. Has a lot of connections of the nervous system. Is the nervous system activated by the brain with these kind of somatic experiences, or because that's something you can study?
Probably, right? Like, cause I mean that I think that goes more on the like the biology part again, where I'm like, I don't want to give wrong facts or so, wrong knowledge, but it makes sense, right? Because if the psych is like having some kind of like need to process something what happened, but just psych wise it just doesn't do it. It needs to do something else, which is like a super skill if you see it that way, right? Because it needs to do something with it. So what does the psych do? It changes it in the body part that's called conversion. So instead of like to process something, it maybe will be stored into the body, so you can have like a kind of free up psyche again to live your life. Okay. And I think it's super interesting because yeah, maybe there are some things where we're like wondering, okay, why is that happening to me? Why do I live healthy? Why do I eat well and everything? Why am I getting maybe like a like a physical disease like cancer? So of course it's not just the psyche, obviously, right? But I think it is overall interesting to think about it, at least, like how come some people, even though they like physically have been like doing very like good life, but maybe something's happened, or like stress is a massive one, which affects hormones, and but it can be like, it goes a little bit more from the psych side, right, rather than of your lifestyle, or rather of the things you eat, or things you do to your physical body. Let's put it like that. So, could I give another example? Actually, I think you might like that one. Yeah. For example, it's not that common as far as I know, but for example, there can be also primary benefits of this conversion when, for example, let's say you have a boss at work, and let's put it like, and the boss is maybe, you know, like just arguing, maybe is like a very difficult person to deal with, or so. It could potentially be that you even, or that someone might even develop a hearing disorder because of that. Isn't that cool? It's kind of like, crazy, I think when I read it, I thought it's like, but you know, but surprisingly, it only happens when they're at work. But it is true. It is not, it's not faking it. The people are not saying, you know, not as an excuse, I can't hear you because I have a hearing disorder now.
But the hearing disorder is diagnosed by a doctor, or it's just a feeling?
So that's the thing, that's the tricky part. When there can't be found something, like, you know, ears and everything is intact, but the people are not lying, right? The people are not, they're really like, they can't hear. Then that's the interesting part, to dig deeper and to ask, you know, how is the boss? How are the colleagues? And that, there are occasions where it comes out, hey, maybe it's like the conversion again, where the body is protecting you. The body is helping you. The body is protecting your mind, your well-being. So how is it protecting? By maybe shutting down your hear ability when you deal with people like that.
It's
and
interesting.
Then, and then that same person can go home, very nice environment, having a good time, hearing is perfect again.
Wow.
Isn't that? Yeah, I think it's really...
Actually, a person I know was under a lot of stress, and she was taking a shower, and out of the sudden got blind for a few seconds or maybe minutes, and she was freaking out, and she realized, I had to quit this job.
Wow. Okay.
It was so stressful.
Okay.
But I mean, fortunately, it wasn't for a long time, but yeah, that's super scary.
And she got that realization while she had...
Yeah, this is, I mean, that was like the breaking point for her. But yeah, I wanted to ask, so yeah, we are not sure if this is, there is research done to catch basically the physical outcomes of these somatic experiences. So like, you, as far as we know, they are not scanning the nervous system running around. But I guess if this is something has been discussed in the psychological community and the medical community, there are methods to help with this.
For sure, yeah.
And what are these methods?
Probably a big one is like behavioral therapy. Do you know behavioral therapy?
No.
It's like, as the word says, it's like how you, like your behaviors, and it has many, or it can have many different, like sub methods, let's say. So for example, like awareness can be one way, right? If you just focus on like the pain again, also like it's very likely to get stronger. So maybe with like this sort of therapy, you learn to like, hey, my fingers feel actually really calm and amazing. So you shift your mind to maybe aspects which do feel really good. Or you can, like also with positive psychology, which has been also rising quite a bit, right? Like you can still have like gratitude practices. Like these grateful journeys have been, I think, kind of like a big boom for a good reason in the last years, right? So where you say like, hey, maybe I'm restricted to my physical pain or my feeling about my physical pain. But hey, I can still do that. I can still see my friends. I can still have some hobbies that I enjoy. So, just shifting the mind, having like some maybe different behaviors in the throughout the day, and like maybe can be structured as well. I think there are many like small things that we don't realize which can have a long or good impact long-term wise when we keep doing these things.
So this reverse this, I guess, way of using the psych to put in the background these painful experiences and transforming it to physical painful experiences, and then basically bring back this to the mind, or what is the idea of?
With the like psychosomatic, with some of the like, if we stick with the example with the pain, for example, like you might have to like deal with it lifelong.
Wow.
Like because some, especially if like pain might become chronic, like I'm not an expert on this as well, but I also know from many people, also myself a bit, that is like also when it's like chronic, it's supposed to be chronic. It doesn't have to be chronic, but that's like maybe a different field. But some of these things, yeah, people might have to deal with their whole lifetime, but maybe the level of experiencing them can be very different. Whereas you start with like from like a scale from 1 to 10, and 10 is the worst, like wow, and 9, like it's really interrupting my life. Like the focus is just on that. I'm thinking all day about it. Maybe with all these different methods that we just said, with the, for example, awareness shifting, maybe it can go from a 9 to a 5 or 4. And that is like already improving life a lot. And it is work, of course, but it can definitely happen. Compared to, for example, with the ear one that we said, or also with your friend that you said with the shorter the second, right? Of course, maybe it's also lifestyle changes. That maybe you talk with a therapist about like what is giving you so much stress, what is giving you like in which situations do you have the hearing disability. So that can also go in the psychoanalytical way, maybe also from the past. Maybe where do you get triggered, and then having this, and then of course there can also be reversed. It
can be reversed.
It can be. It's individual, of course. Overall, the psychosomatic ones might not be that well like having completely results compared to other, for example, like a phobia. If you have like, or if someone has like a phobia against spiders or something, some of these mental health issues might be easier and long-term wise better to treat than others. And psychosomatic one is maybe one of the ones which is not as easily treated as others. Let's say it like that.